Hello friends, today we are going to learn about Endfeel. This video has been prepared by Dr. R.S. Buddha and Dr. Kenny Buddha, Assistant Professor in Dick's Institute of Physiotherapy with CTU Campus, Varnama, Vadodara. Endfeel. Endfeel is the feeling or perception of the resistance or a barrier to further motion which is experienced by an examiner at the end of passive range of motion. Types of Endfeel. There are two types of Endfeel, normal Endfeel and abnormal Endfeel. Normal Endfeel is further been divided into three types, soft, firm and hard. And abnormal Endfeel is being divided into soft, firm, hard, empty and springy block. Normal Endfeel. When assessing passive movement, the examiner should apply overpressure at the end of the range of motion to determine the quality of Endfeel of each passive movement. A proper evaluation of Endfeel can help the examiner to assess the type of pathology present, to determine a prognosis for the condition and to learn the severity or stage of the problem. There are three classic normal Endfeels. Let us first see what is normal soft Endfeel. In that soft tissue approximation, with this type of Endfeel, there is a yielding compression, that is muscle feel that stop further movements. For example, elbow and knee flexion, in which the movement is stopped by compression of the soft tissues, primarily the muscles. In a particularly slim person with little muscle or bulk, the Endfeel of elbow flexion may be bone to bone. Normal form Endfeel. Tissue stretch. The normal tissue stretch Endfeel has a feeling of rising tension or stiffness. There is a feeling of elastic resistance. For example, hip flexion with the knee straight. That is mainly occur because of passive elastic tension of the hamstring muscle. Tissue stretch is the most common type of normal Endfeel. Second one is capsular stretch. It is found when the capsule and the ligaments are the primary restraints to movement. For example, lateral rotation of shoulder, extension of MCP joint of fingers, that is metacarpophalangeal joints of fingers, in that mainly occurs because of the tension in the anterior capsule. Now third one, ligamentous stretch. In that forearm supination. In forearm supination, you may feel a ligamentous stretch type of feeling. That is mainly because of tension in the palmar radioulnar ligament of the inferior radioulnar joint, interosseous membrane and the oblique cord. Now let us see what do you mean by normal hard Endfeel. In that bone to bone, this is a hard, unyielding sensation that is painless. For example, elbow extension. Now let us learn about abnormal Endfeel. In addition to the three normal types of Endfeel, there are 5 classic abnormal Endfeels, several of which have subdivision and each of which is commonly associated with some degree of pain or restricted movement. Let us first see abnormal soft Endfeel. It occurs sooner or later in the range of motion than is usual or in a joint that normally has a firm or hard Endfeel. For example, you may get a boggy type of feeling, soft tissue edema or synovitis. Abnormal firm Endfeel. It occurs sooner or later in the range of motion than is usual or in a joint that normally has a soft or hard Endfeel, which is similar to normal tissue stretch Endfeel but with a restricted range of motion. You may get an abnormal form Enfield whenever there is an increase in muscle tone or during capsular, muscular, ligamentous and facial shortening. Abnormal hard Enfield. Bone to bone. This abnormal Enfield is similar to the normal bone to bone type, but the restriction occurs before the end of range of motion would normally occur, or where a bone to bone Enfield would not be accepted. An example are chondromalacia, osteoarthritis, loose bodies in joint, myositis ossificans, fracture and osteophyte formation. Empty Enfield. The empty Enfield is detected when a considerable pain is produced by movement. The movement cannot be performed or stopped because of the pain, although no resistance is felt except for patient's protective muscle splinting or muscle spasm. For example, tumor, acute joint inflammation, acute bursitis, abscess, fracture, and psychogenic disorders. Springy block Enfield. It is similar to a tissue stretch. This occurs where one would not expect it to occur. There is a rebound effect with a thick stretching fill. It is usually indicates an internal rearrangement within the joint. It found with a torn meniscus of a knee when it is locked or unable to go into a full extension. Some important notes. The Enfield of the capsular tightness is different from the tissue stretch Enfield of the muscle tightness. The capsular tightness has a more hard elastic feel to it, and it is usually occurs earlier in the range of motion. If one is unsure of the Enfield, the examiner can ask the patient to contract the muscles acting in the opposite direction, 10 to 20% of the maximum voluntary contraction, and then relax. The examiner then attempts to move the limb further into the range. If the range increases, the problem was muscular and not capsular. Now have a quick look on the normal Enfields.
Dear friends,